up to and just beneath the lower lip on both sides. So remove all the fur or the hide over the floor of the oral cavity and the throat. Then on the side you're dissecting, I want you to go from that cut, just caudal to the corner of the mouth, and go up from the corner of the mouth to just caudal to the corner of the eye, all the way up to the dorsal midline, or a little over, and continue back to the neck. And remove the hide from that half of the head so that you can see the temporalis and the masseter. And after we're done with muscles, then we'll also be looking at nerves and blood vessels up there. So that's what you're going to have to do next. And I'll probably show that dissection and those muscles, over the next couple of nights in the night labs. And we can catch up on those in here next Tuesday, because next Tuesday we don't have any new assigned muscles. It's just going to be time for you guys to catch up before the midterm. Also, in case you didn't know, on our D2L page for the lab, I have a link to a YouTube channel where I posted a number of the dissections that various students have recorded. And so you can see, I started it last year, the year before, I think, with COVID. And so I got all the a lot of second half dissections posted. And then this year I've been posting the dissections for the first half on muscles. And so you can go to that YouTube video list through the link on D2L, and you can see most of the stuff for review. Some of them have students have filmed themselves doing it, and the accuracy on theirs is kind of iffy, but it still gives you a chance to see this stuff. And I think I've got a copy of just about every one of my little dissections like these that's up there. So the other dissection we're going to do, first of all, you're going to be looking for the intercostal muscles that we'll get to in a minute, and the rectus thoracis. And unfortunately, theirs is not a real good example for the rectus thoracis, but if you remember the rectus abdominis running longitudinally from the pubis up to the thoracic cage on either side of the midline, on cats, the rectus abdominis actually goes up most of the way up the rib cage, and at its cranial end, and it's hard to see on this guy, but there's a little slip of muscle, little thin sheet of muscle that goes at an angle up toward the shoulder joint, the shoulder articulation. And that's the rectus thoracis. So rectus abdominis and rectus thoracis form kind of a Y-shaped structure or arrangement, where rectus abdominis goes longitudinally, cranially, and then up here it branches off as rectus thoracis. And that's this muscle that's right here. And on most of yours, you should see a nice border showing you that it's going diagonally. The other muscles that you have down here are the intercostal muscles. And for those of you who dissected through the external obliques, I'll just pretend you guys did. You can continue that dissection or that section up onto the rib cage. And if you peel that back, then you'll be able to see the costal cartilages from each of the ribs. And in between those cartilages, or if you're further dorsally, between the bones of the ribs, you'll see muscles that run from rib to rib. And laterally, if you're looking out here, laterally or dorsally in that intercostal space, you'll see the external intercostal muscles. And these muscles are a continuation of the layers you looked at in the abdomen, where you essentially have 3 layers of muscle. The external intercostal are like the external oblique, but the intercostals have the ribs kind of separating them from segment to segment. And so the external intercostals are the outermost layer, and then beneath those you'll see internal intercostals, and the external intercostals will often, they'll run through the dorsal part of that intercostal space and then stop as you get out here more ventrally. And so on your cat, you should be able to see, if you kind of clear away the fascia over the surface, where that outer layer of muscle stops, and you just see the internal intercostals more ventrally than that. Both of those go from rib to rib to rib. So one characteristic about the intercostals is they're really short fibers that just go from one rib to its neighboring ribs. And they're oriented in different directions, so that the external intercostals, when they contract, will pull up on the rib caudal to them, and that expands the thoracic cage, opens up your rib cage for when you are inhaling greater than your normal tidal rhythm. The internal intercostals, when they contract, essentially pull the upper rib down towards the other rib that they attach to. So it pulls each of the ribs down. That compresses the rib cage. And so we use the internal intercostals for expiration when we want to really breathe out harder than normal. So you'll be able to see those as you clear this away. And then deep to those, usually it's pretty restricted in the near the midline, in the more ventral intercostal spaces, is a transverse thoracis. And that is similar to the transverse abdominis. It's the innermost layer. And it's a pretty restricted extent of the muscle. So if you're just looking up here, you probably won't find it. If you're looking down near the sternum, you can usually find that inner layer. Okay, now when we move up to the other axial muscles, if you remember back here when you dissected into the thoracolumbar fascia, you saw the erector spinae and the multifidi. And the erector spinae is a pretty big band of muscle that's running up from the pelvic girdle, from the ilium and sacrum, and is running up the back. That erector spinae group will split up into 3 columns of muscle when you get up to the thoracic region. And so we're going to be looking for and identifying those 3 columns of muscle. And to see those, first you'll notice on your animals that whole complex is covered by a fascia. And that fascia is an attachment site for some of the axial muscles. And one of them that attaches onto it is the serratus dorsalis. Now we saw the serratus ventralis coming from the scapula and going to the ribs. And so the serratus ventralis inserts onto this dorsal border of the scapula and goes down to the ribs. And that was this sheet that I told you guys to be careful of, deep to the scapula. And it forms this big fan-shaped muscle that inserts onto the ribs, and we'll see that a little bit later also. Between, medial to that, on the body wall, is the serratus dorsalis, and the serratus dorsalis comes from this fascia I just talked about that originates from the thoracic vertebrae, and that is the aponeurosis for the serratus dorsalis. So usually, I told you not to cut through aponeuroses, but in this particular case, it works better if you cut through that fascia and peel it back. And then we can carefully pull back on the serratus dorsalis and the ventral part of that fascia. And it's often pretty tightly attached to the ribs as it goes. But if we can separate it without tearing it up, you'll see that the serratus dorsalis is this real thin sheet that lies within that fascia. And it inserts onto the ribs like the way that the serratus ventralis inserts onto the ribs, only it's more dorsal, hence the name. And it forms kind of a serrated or sawtooth attachment to the ribs. So now you can see that this sheet that I'm holding up here has a thin layer of muscle tissue in it. And that thin layer of muscle tissue inserts onto each of the ribs. So serratus dorsalis lies in the fascia that overlaps the erector spinae group. Now, once we get that pulled back, then we want to also be able to see that group going up medial to the scapula. And so we want to bisect this muscle group that goes from the vertebral column, the spinous processes, to the scapula, to the dorsal border of the scapula. And that's rhomboideus. And what I recommend, what I usually like to do, is try to keep rhomboideus capitis intact, just because it's easy, because it's so small and thin, it's easy to forget where it belongs later on if you bisect it. So I try and keep that intact, but I'm going to bisect the rest of the rhomboideus complex, rhomboideus cervicis et thoracis. And when you do that, again, be careful of the serratus ventralis just deep to it. So when you bisect the rhomboideus cervicis et thoracis, you want to abduct the scapula a little bit and try to go about in the middle of the muscle length so that you've got a little bit of a stub proximally coming from the vertebrae and a little bit of a stub distally going to the scapula. Because again, that makes it easier to see where they attached, where the other half of that muscle is. So this is the origin of the rhomboideus coming off the scapula, the vertebrae right there, and here's the insertion out here, partially covering the serratus ventralis. And it's hard to separate some of those fibers, but we'll separate a little of them just so that you can see that stub where it goes to the scapula. And then now you can see the medial surface of the serratus ventralis. You can see the extent of the serratus ventralis right here, and you can see why it's described as a big fan-shaped muscle. And this is serratus dorsalis, and there's a little bit of serratus dorsalis here, and I want to continue that cut I was making up through the fascia so that we can peel that portion of serratus dorsalis back similarly, and we can see the underlying muscle that are part of the erector spinae group. Okay, so now we can pull some of that fascia back. I won't worry too much about it yet. So when I do that, you can see serratus dorsalis continuing cranially in that fibrous layer. Okay, so now we want to look at those epaxial muscles, the erector spinae group, and the erector spinae group, as we saw before, runs underneath the thoracolumbar fascia, and then it extends up into the thoracic region, and it forms 3 columns. The lateralmost column is from here to here, and this column is characterized by diagonal tendons that you can see, the shiny tendinous fibers that are going at an angle out to insert onto the ribs. And so there are multiple slips of tendon that go out to the ribs. And that is iliocostalis, because it runs from pelvic girdle, the ilium, out to the ribs. So from here to here, this column right here is iliocostalis, and it gradually turns laterally as you go more cranially, and kind of disappears as it curves outward towards its last insertions. So that's iliocostalis. The next column up from that is a large muscular bundle that is the longissimus dorsi. And the longissimus dorsi continues, it's from here to here, continues up and will go to the vertebrae, and then has a little extension that goes up to the head called longissimus capitis. And we'll see that in a few minutes. That lies beneath a superficial sheet of muscle that we're going to have to bisect first. And then the dorsalmost column is a column that is characterized back here by a muscle called the spinalis. And that muscle on this animal, that's probably the border of it right there, comes across and then inserts right about on the vertebrae. It runs from the vertebrae in the caudal thoracic region to vertebrae more cranially. And because it's going from vertebrae to vertebrae, it'll form what looks like a D-shaped boundary, or like semicircular shaped boundary. And so you'll be able to see that it has a convexity curving out towards you, or towards me in this particular view. And then at that point, it continues, that column continues as another muscle that curves the opposite direction called the semispinalis. And that semispinalis also lies deep to this superficial layer that we're going to have to bisect. So in that dorsalmost column, we have the erector spinae giving rise to the spinalis, and then the semispinalis, whose curves the opposite direction, so the convexity is kind of toward the midline. Now that muscle, the semispinalis, and the cranial part of the longissimus lie underneath a thin sheet of muscle that forms like a cape over the neck, the back of the neck. And usually you can find the boundary of that, the lateral boundary of that muscle, if you look down behind or deep to the serratus ventralis. And you can start to peel that back from underlying muscle, and it's a pretty thin sheet that is, the fibers are oriented diagonally from the vertebrae out. They come out like this, and then they attach to the base of the head. And this is the splenius. So I'll clear a little more tissue away there. And once you start to get that lifted up away from the muscle underneath it, then you can hold it up and carefully bisect, probably at an angle heading dorsally, up about as far as you can go depending on your dissection. And carefully peel that back, because just beneath the splenius you can see this little bundle of muscle here that is the extension from the longissimus that I talked about. So I'm going to peel this back dorsally. Now I'm holding the splenius back, and down here, just dorsal to the serratus ventralis, is a little column of muscle that you can see continuing from longissimus dorsi. So this is longissimus dorsi going under the splenius, and there is a slip of that muscle that continues up to the head. And that is longissimus capitis. So here's longissimus capitis. And just dorsal to longissimus capitis, you can see this large muscle that has a separation here in some cats. And this is semispinalis cervicis et capitis. And so the semispinalis muscle is going up to the cervical vertebrae and also to the base of the skull. So if we look back at these columns, iliocostalis is the most ventral, and it's characterized by these tendons, a series of diagonal tendons that are going out to the ribs. Above that, dorsal to that, is the longissimus dorsi, which terminates up here in the more cranial ribs and or thoracic, more cranial thoracic region, and gives a final column of muscle as the longissimus capitis. And then the dorsalmost is this semicircular spinalis that stops right where it's kind of overlays the surface of this semicircular semispinalis that kind of curves the opposite direction. So those, what do I want to say with those? Make sure you can see the characteristics of each of those. And to see those, again, you can't see those until you've pulled the fascia and the serratus dorsalis out of the way. You can keep the serratus ventralis intact because you're going to need to, that's basically all that's holding the scapula to the body. There was something else I wanted to say, but I can't remember. Okay, so that part, all of this on the chest is something that you should be able to get to today. And then, as I said, over the next few days, we'll start working on the head. And I'll probably go through the head and neck musculature next Tuesday in lab. Okay.